What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering thinking outside of the box for this beautiful field of radiology, how to get the most optimal images. Most of these will come for the emergency room. That's kind of where you need to do it. So to give you context, I am night shift Xray tech. I've been doing it for over 4 years now. And I would say for sure, you will do many things. Maybe you'll discover techniques. I would say anything that is within your little domain of shooting x-rays via glove box, via purple wipes, via stretchers, via whatever you have around you can be used to hold the board, because these patients will come up. Maybe it's their body habitus. Maybe it's the patient's condition that does not allow their leg to bend. Majority, like where I run into this problem or this master technique, is in the foot. The foot, trying to get the AP and the obliques. Sometimes it's just AP and lateral. The bending of the foot, that to me has caused me so many times to have to use some of these techniques where you'll literally set the board and tell the patient, can you bend the leg? And they'll bend it. And they'll just be bent. They'll just be propped like this instead of like stepping on the board, right? It'll just be like this. So then you come with your little x-ray board, and then you're like, okay, well, the x-ray board's straight. There's a big gap. And you'll shove like a little glove box or purple wipes or even another table just to tilt it. And now you have to angle the tube. Or sometimes you can just angle the tube hard and it will compensate for it. Because sometimes it's easier to just put the work in and do that instead of like grabbing the lead and then shoot it, come back, look at the images, readjust, and go back and forth. There's time in the trauma room where we're really, really busy, and sometimes the easiest way is just to hold the board, get some lead, and just kind of angle hard and just keep it pushing. Sometimes you're just gonna have to get some little daily dose of radiation. But when you can, just try to find ways. I mean, I've seen techs to use pillows. I've seen techs to use like folded up little sheets, just to get the job done. Let's see. Sometimes with like the shoulders, if we do it portable, sometimes the patient isn't able to like roll, or their arm is kind of messed up. So sometimes we use pillows. Sometimes for like lateral knees, we'll like lay the board against the rail and just have the patient like tilt their leg. Not like a cross table. It's still considered a true knee because you didn't shoot it the other way where it's considered a cross table. But cross table is, another common technique you can use. Let's see what else. Sometimes using the PD board for like an elbow or a shoulder, because like sometimes the patient got too much stuff going on, or they can't move that much, or maybe they're really big and you can't really, like sometimes the PD board is more optimal because like you can like place it on their stomach. Sometimes these patients' wrists are broken, and instead of bringing the big old board that will like hit their like elbow or hit something, you can just like grab it, put it on their stomach, or put it somewhere. Now, you can literally use anything. Some places have little holders, x-ray holders to hold the board. Some places have little foams you can use that are all x-ray radiolucent. We always got to be careful whatever you're using doesn't show up on the images. Sometimes you don't have no choice because like it impacted the patient. Like something's in there, they can't move. But that's really about it on that. I mean, anything really, literally anything can be used as an X-ray, like holder, like anything. I've one times had to adjust the patient, and the floating little computer the nurse uses, I literally just tilted it against it, and it was like the monitor was holding it. You can literally, as long as you get the job done. I mean, sometimes nurses will be laughing at us because like the amount of stuff we use is not for what it's intended to use. But like, as long as it gets the job done and you get the optimal images, no one's gonna complain. Just like sometimes it literally looks like a mess, and then you just put the room together and you're like, well, we got the job done. Sometimes the patient will just be asking questions because they never seen techs use that many things or that many equipment. And sometimes you're just like, oh, we're just using it to, help us get the job done, or whatever you have to come up with to hold it, because you're like, now we got to do this because your leg's messed up and you're not able to bend it. Like, I try never to, like, make the patients feel bad. But, yeah, hope that helps somebody out there, because I know when I was a student and I saw that as a student and I saw certain techs do stuff, and I was like, that is wild. And he's like, the tech was at the moment was like, yeah, Miguel, it's like literally whatever you want. If it's within here and you think you can use it to get that best image to help you out, go for it. It's literally a little sandbox of things and tools and resources. Use all your resources. And I was like, that's what's up. So we'll see you on the next one.